What is stress urinary incontinence? A urethral sling is used to treat stress urinary incontinence, or SUI, in women. The urethra is shorter in women than men, which causes women to have a higher risk of involuntary urine loss. SUI can be triggered by coughing, laughing, or sneezing, or during certain physical activities such as walking, running, or exercising. Pregnancy, childbirth, and aging can also contribute to SUI. Kegel, or pelvic floor strengthening exercises and physical therapy, can aid in reducing SUI, but sometimes a surgical procedure called a urethral sling is required. Procedure. The urethral or bladder sling procedure is an outpatient vaginal procedure that lasts about 15 to 20 minutes and is performed using general anesthesia. The purpose of the procedure is to help reduce accidental leakage by lifting the urethra back into a normal position. The sling also exerts pressure on the urethra in order to aid in urine control. For a sling procedure, your surgeon uses strips of synthetic mesh to create a sling or hammock under the tube that carries urine from the bladder. The sling supports the urethra and helps to keep it closed, especially when you cough or sneeze, so that you don't leak urine. The sling procedure that's best for you depends upon your situation. For a tension-free sling procedure, your surgeon may use one of three approaches. Retropubic. With the retropubic approach, your surgeon makes a small cut or incision inside the vagina just under your urethra. Your surgeon also makes two small openings above your pubic bone, just large enough for a needle to pass through. Your surgeon then uses a needle to pass the sling under the urethra and up behind the pubic bone. A few absorbable stitches close the vaginal incision, and the needle sites may be sealed with skin glue or stitches. Transobturator. With the transobturator approach, your surgeon makes a similar vaginal incision as in the retropubic approach and also creates a small opening on each side of your labia for the needle to pass through. The sling passes in a different pathway from the retropubic approach, but it's still placed under the urethra. Your surgeon closes the vaginal incision with absorbable stitches and the needle site with skin glue or stitches. Single incision mini. With this approach, your surgeon makes only one small incision in the vagina to perform the procedure. Through this single incision, your surgeon places the sling in a manner similar to the retropubic and transobturator approaches. No other incisions or needle sites are needed. Risks and complications. Like any surgery, although unlikely, risks and complications may occur. After the sling procedure, you may experience difficulty urinating or emptying your bladder completely. You may develop an overactive bladder, which can cause temporary urge incontinence. Some women may get a urinary tract infection or find intercourse to be painful or difficult. These symptoms usually go away after you've fully recovered. Be sure to call your physician if you start running a fever or have drainage from the incision site. If synthetic mesh is used, there is a small risk, less than 5%, that the mesh will erode through the vaginal wall, causing infection or long-term pain. Less than 1% of patients may have to have follow-up surgery. Another risk is possible injury to the bladder or other pelvic organs by the instruments used to place the sling. However, these injuries usually do not lead to long-term complications. Prepping for the surgery. Several days before surgery, all blood thinners are stopped. Please ask your physician about specific medications to avoid. As with all surgery requiring a general anesthetic, please do not eat or drink anything after midnight the night before your procedure, and you must arrange for transportation after the procedure. As an added precaution, you will be given an antibiotic the day of your surgery to reduce any chance of infection. Post-op and results. After the procedure, you will spend a short amount of time in the recovery room. You will need to have someone drive you home afterwards, so be sure to make arrangements for transportation. A small percentage of women may have to go home with a catheter due to voiding difficulties, but this is rare. Avoid anything that puts stress on the surgical area, such as excessive straining, strenuous exercise, or heavy lifting for about a month. Avoid any sexual activity for about a month or until you are cleared by your physicians. The good news is that nearly 90% of women experience significant improvement for 10 to 15 years after surgery. For many women, urethra sling surgery is a very effective therapy for the correction of urinary leakage. Your urologist and clinical staff will answer any of your questions and provide additional information to help you decide if this procedure is appropriate for you. Thank you for taking the time to view our video. We hope that you are better informed about your upcoming procedure.